How do you know how much sertraline to take, and what happens when you decide to increase the dose or reduce the dose? Welcome back to A Happy Change. It's amazing to have you back. I really do appreciate the time that you've taken to watch this video. I really hope this is a useful one. One of the most common comments I see surrounds dosage levels. What is the correct dosage for me, and what happens if I want to change or stop completely? So thinking back to basics, sertraline is an SSRI. I've already spoken about the way that SSRIs affect your brain, affect your body, and affect your well-being. So if you haven't watched that, I'll put a link in the description. And sertraline is used to treat lots and lots of different mental illnesses. So you might be taking sertraline right now for general anxiety disorder, you might be taking it for depression or some combination of the two. Maybe it's PTSD, OCD, the list goes on. Sertraline is a really well-known and well-received all-rounder when it comes to antidepressants. That's why it's so commonly used, and that's why it's so commonly prescribed by GPs and doctors globally. So the most common normal dose is 50 milligrams a day. I'm aware that lots of people actually start lower than that. So some people, their doctor will have prescribed them 25 milligrams and monitor it to see how it goes. Now, this is a useful thing to do, perhaps if you're particularly anxious about taking medication, or if you've got milder symptoms, perhaps the doctor might decide it's a better place to start you at 25 milligram. Quite common in anxiety disorders like OCD, PTSD, the doctor might start off a lower dose and allow it to be kind of built up over time. Now, the useful thing to know is that dosages can rise fairly quickly. So perhaps for a week on 25 milligram, you could review with your doctor, move to 50 milligram, and so on. However, dosage builds in 50 milligram increments. So perhaps you're on 100 milligram, 150 milligram, or 200 milligram, which is the usual maximum dose. Please don't worry if you're at the bottom end of that scale or the top end of the scale. Our bodies and our brains react really differently to medication. So it's really useful to know that if you are on like 100 milligram or 150 or 200 milligram, it doesn't mean the doctor is super duper worried about you necessarily. It more likely means that your body is responding in a different way, and a higher dose is going to be more effective than keeping it at a level 50. And likewise, 25 milligram will still have an impact on you. It'll still have a positive effect on you. So if you are prescribed 25 milligram, don't worry and think, why have they started me with this baby dose when I'm not going to see any change? It's good to build incrementally, and your doctor's probably made a decision based on their understanding of your immediate needs and your current health levels. So whilst most people stick to 50 milligram, if after, say, the 6-week period you'd normally expect to start feeling a change, very little has happened, then speak to your GP and ask for a medication review. Now, it's likely what they'll suggest is give it a few more weeks at 50 milligram and then we'll come back and we'll review it. But at that stage, what they'll determine is whether or not it's the right dosage. Now, if you're still really struggling, say, for example, with depressive episodes or with anxiety, then they might look at increasing it by 50 milligram to 100 milligram. And the same goes as you move through the scale. It isn't a problem to go back to the doctor and just say, look, this isn't working for me. At each stage, they will be able to review, firstly, whether the dosage is right, and secondly, whether or not sertraline is the right medication for you. It might be that you have a better response on a different antidepressant or anti-anxiety medication. So bear that in mind. This is trial and error. Please don't worry as you move through, or as your doctor decides to increase a dose or look at a different alternative medication. This is fairly normal. Lots of us on this channel, lots of the people that engage with the comments will have tried different medications until they've settled on the one that works for them. For me, sertraline is working. If it doesn't for you, talk to your GP, and I'm sure they will be able to offer either an increased dose or an alternative. So what happens when you think it's time to change your dose, or your doctor suggests this would be necessary? And that can go either way. Either it's an increased dose, so going from 25 to 50 or 50 to 100 milligram, or it's an idea that you've got to reduce the dosage or to remove the medication altogether. So the first thing I would say is don't make the decision in isolation. Please have that conversation with your doctor. They will be best placed to advise the next step, whether that's an increase or a decrease in medication. It's really important because the medication is so powerful that your doctor has their medical opinion on the best decision to make. So it can be tempting sometimes if you're having a rough time to cut completely, and likewise it might be tempting to like double dose sometimes and take 250 mg tablets if you're having a particularly bad episode. I would urge you to stay away from making those sorts of decisions in isolation. If your doctor hasn't prescribed you 100 mg, don't double dose. Simple as that. And likewise, if you decide you want to cut out completely, have that conversation with your doctor. Even if that sounds like it's going to be another difficult conversation, you need to be medically advised and best informed about what is going to happen. As you increase dosage, one of the things that you might find is a return to some of those physical and mental side effects that you probably dealt with in the first couple of weeks. So we speak a lot about side effects on this channel, but it might be that if you go from 50 to 100 ml, you suddenly find that you're suffering from like your dry mouth or your upset stomach again. I would say that from experience and from talking to other people, actually the symptoms of those side effects usually pass much more quickly because your body kind of understands what's happening. It's like, oh, I recognize this change. And you're able to deal with things a lot quicker than perhaps you were in those first couple of weeks. But just bear in mind that if you do increase dosage, it's possible, not 100%, but it's possible you're going to feel some sort of physical side effect reset for at least a couple of days. If you decide that you want to stop taking the medication or you want to reduce the dose, please talk to your doctor. So going cold turkey has a profound impact on your nervous system. Your brain is used to this helping hand, and as soon as that is removed, it causes a lot of stress. In my own scenario, it caused huge amounts of anxiety, depressive episodes, and panic. So that's from my experience. It might impact you differently, but I did it in a less controlled way than my doctor would have wanted. Actually, I should have tapered down probably to 25 mg and then tested that out for a bit. So your doctor is the best person to advise you on this. As tempting as it might be just to cut or throw the packet away, actually what needs to happen is you need to have an informed conversation with your doctor. You can explain that you don't wish to take the medication again, and they can help you taper that dosage down to a point that withdrawal is less impactful and less negative on your mental health and physical health. So in short, everyone's going to have a very different response. Consequently, a different dosage is likely from person to person, and actually the stages of ramping it up or moving it down is going to be different for everyone. Don't worry about comparing yourself to other people. We've all got a different response to these sorts of medication, and actually it's important to use a little bit of trial and error and informed judgment to determine not only what is the best dose, but like I say, what is the actual best medication for you. It's amazing to see this channel grow and grow. So if you are finding these videos useful and you haven't already subscribed, please do so. Please like the videos, and if you've got a comment to make about the videos or you've got a story to share, please do share them in the comment section. It means a massive deal. Likewise, if you want to join the private Facebook group, there's a link in the description and you're always welcome there. I'll see you next time.